Who doesn't know what it feels like to have low back pain? Today, we will talk about this very common problem, low back pain, and we will focus on how we treat low back pain, which depends mainly on whether this is a new problem that has been going on for a few days or a few weeks, or a chronic issue that has been going on for 3 months or more. If the pain is new, have been going on for a few days or a few weeks, there is a very high chance that it will improve naturally without any intervention. So first, we make sure there is no serious underlying cause to the pain, which are very rare, like a fracture, an infection, or a tumor. And then we manage the pain using conservative measures like applying heat traps to the back, which can be effective and even more effective than medications like ibuprofen or naproxen as shown in this study. We also can use medications like ibuprofen or naproxen available over the counter, or a muscle relaxant like cyclobenzaprine for a few days. There is no evidence that combining the cyclobenzaprine with the analgesic like naproxen or ibuprofen is more beneficial than using one or the other as shown in this study. So either use ibuprofen or naproxen, or if you can't take these medications, then consider taking cyclobenzaprine for a few days. Also, you may consider physical therapy. There is good evidence that exercises and physical therapy can help with acute low back pain. Now, if the pain has been going on for 3 months or more without improvement with all these modalities, at that point, we work on identifying the exact source of the pain. And when we talk about the sources of low back pain, we talk about 3 main structures in the spine. The first structure is called the facet joints. These are the small joints in the spine that help us move, bend, and twist. The other structure is this sacroiliac joint. The sacroiliac joint is a bigger joint that connects the sacrum with the pelvis. And the third structure are the intervertebral discs, which are the cushions between the vertebral bodies, the bones in the spine. So, to know the source, we depend on what we call diagnostic blocks. For example, if we think the source of the pain is likely the facet joints, we go to these facet joints with small needles under X-ray, and we inject a numbing medication, a small amount of a numbing medication like lidocaine or bupivacaine to numb these joints. If for a few hours we see significant improvement in the pain, then we say that yes, it's highly likely that these joints that we numbed are the source of the pain. At that point, we proceed with a second diagnostic block to confirm that, and if that confirms the relief and the patient gets good relief with the second block and we confirm that these joints are likely the source of pain, then we proceed with what we call radiofrequency ablation or radiofrequency denervation of these facet joints. And in that procedure, we advance special needles that have tips we can heat with the radiofrequency ablation machine, and we heat and destroy the small nerves that innervate these joints, which are called the medial branches, so that the joint will be numb for a longer period of time. Studies show that on average 70% of patients who improve with 2 diagnostic blocks will improve between 8 to 15 months with these ablations. The pain comes back because these nerves grow back, but if it does come back, we proceed with repeat ablations, which are outpatient procedures that take between 15 to 20 minutes to complete. Now, if we think the source of the pain is the sacroiliac joint, we can do steroid injections. We place a needle inside the joint and inject a numbing medication and a steroid under X-ray. We can also do radiofrequency ablations. However, these ablations cannot completely denervate the joint. We can only do the ablations to destroy the sacral lateral branches, which innervate the posterior capsule of the joint or the back portion of the joint, so that we can decrease part of the feeling of the joint. And we can also do fusions, in which we place a small bone graft inside the joint to fuse the joint and prevent it from moving, which can also help with the pain. What about disc pain? If there's a herniated disc that causes pain all the way down the leg, that is different. That's called sciatica, which we discuss in a separate video. Here we're talking about axial low back pain, pain in the lower back. So if the pain in the lower back is caused by a problem with a disc, treatment of that is palliative. There is no evidence for any procedure to help with discogenic low back pain. Even surgical procedures like disc arthroplasties to replace the disc with an artificial disc, or fusions to fuse at that disc level so that there is no movement and no pressure on that disc, has not been shown to be effective, and most patients do not improve with these procedures. So there is no place for surgery in treating axial low back pain, pain in the back that is not caused by narrowing in the spinal canal or not associated with pain in the lower extremities. Finally, spinal cord stimulation therapy can be used to treat axial low back pain, whether that is pain after spine surgery, which we call failed back surgical syndrome, or pain that is refractory to all the treatment modalities we discussed and there is no indication for surgery, which we call non-surgical refractory low back pain. I discuss spinal cord stimulation therapy in details in a separate video. If you would like to learn more about it, you can watch that video. Thank you.